Welcome to Functional Fridays. I am Sherry Jacobs, naturopathic doctor, certified nutrition specialist. I'm with Shannon Kennedy, internal medicine doctor. Today we want to talk about something that is also very common. We always pick common topics, I think, acid reflux. And so in how I was trained with acid reflux is very counterintuitive for people. And, we've explained this a million times over to people because it just doesn't make sense. But ultimately, when you are having acid reflux and you feel that acid coming up, you automatically assume that you're overproducing acid. It's pretty rare to overproduce acid. That's the unusual circumstance. Now, certainly when you take an acid blocker, it feels better and the symptoms go away for most people. So you assume, again, it is high acid. But really, if you're looking at the underlying cause, for many people, it's actually not enough acid. Because if you were making plenty of acid, the food that's getting digested would go right down the track. Instead, it sits under that upper esophageal sphincter and doesn't get digested well. So then when you feel it come back up, you're alive, you're making some acid, and you're going to feel that burn, you're going to feel that regurg. So we are often giving people acid or discussing ways to improve acid secretion, which is counterintuitive, but it really does work well. The flip side of it is you also have to figure out what are you not digesting well, what's taking up your acid, what's using your acid, and that's where foods come into play. You really do have to manage your diet when it comes to acid reflux. And we have this cleanse program that we created and been running for 10 plus years. Always knock on wood, I'm not on wood, but we never have had anybody leave with acid reflux because we take away those common food sensitivities that cause acid reflux. And so I'm convinced that 95% of acid reflux is related to foods we're eating. Agree?
Yeah, I definitely agree with that. There's not a more obvious disease process that when you put food in your belly and it comes back up with the acid, painful feeling in your chest, your body's screaming, please don't give me that anymore. So the common things like caffeine and chocolate and alcohol and things that are carbonated that kind of force things back up. And people sometimes say, and then of course anything acidic, and I'm like, no, not anything acidic. Like you can have tomatoes and things like that. Often it's not the problem, but it's the pizza crust that the tomato sauce is coming on or the pasta. So keeping a food journal is really important, and if you have those symptoms, listening to your body and just being committed to identifying that food. But if you're one of those people who have a really clean diet and have done the eliminations, and every time you add something back, you're symptomatic, and so your diet is so limited, it's important to consider that, you might have too little acid and doing and looking into ways to add acid or add production of acid back into your stomach is very important. And of course, if you do that and your symptoms get a lot worse, then we know, okay, well, maybe you do have an overproduction of acid, or maybe you have a stomach ulcer or something that requires more of a conventional medicine workup with an upper endoscopy. Until you've really looked at the foods and tried to add, acid or digestive enzymes or something back into your diet, you're doing your body a huge disservice by just jumping on an antacid medication, because you're making it impossible to digest your food completely when you take an antacid. When you do that, you're not absorbing the micronutrients. You're absorbing the macronutrients, you're going to get the fat, you're going to get the protein, you're going to get the carbohydrates, you're going to get the sugar, and you're not going to get the micronutrients, the good minerals and vitamins and things that tell your brain that you have enough. So people who are on acids and they're eating and their bodies aren't absorbing the micronutrients, and often is one of the contributors to obesity. You tend to overeat. When you overeat, guess what? More stuff comes back up and you need more.
And ultimately, you're undernourished at the same time, but you've got over too many calories.
Absolutely, overfed, undernourished, poor nutrients, and we see a lot of bone loss or magnesium deficiency, and then ultimately thinning bones and stuff from people who are on these proton pump inhibitors for a long time.
How long should you be on PPIs?
I put people on them for 2 to 4 weeks to see if I'm going to give you this and you feel better. That's great. It helps with the diagnosis, and then you got to come off it. And you come off it if the symptom comes back. Then because a lot of people out the gate won't just change their diet. So I said, I'll put you on this, and if you feel better, then we have to figure out what's causing it. So they feel better, they get off of it, symptoms come back. I say, okay, let's eliminate certain foods and see if we can identify it. And then it just depends on the person whether or not we make any progress in that area. I have people who are on it for years and years and years, and I got to look at their magnesium, I have to look at their bone densities,
B12 levels.
Yeah, and they're not ultimately. I don't think I have any person that's just only on a proton pump inhibitor and doesn't have these other, other medical issues in their life. So yeah, I do look at that as one of those areas that that cause disease. You know, we treat a disease and we're causing 3 others, and so it's important to know the other ways to approach it.
Yeah.
Yeah.
And it's a good point, because this is the entryway into the rest of your system. So it's the HCl, stomach acid, is your protective barrier. So you're set up for so much more dysfunction, letting different microbes in, and dysbiosis, and all those downstream effects, you know, with everything on the gut microbiome and your digestive health affect the entire rest of the system. So it really is a cascading effect. And so many people are never told that they should only be on these PPIs for 2 to 4 weeks. I mean,
I think that slip in the thing says 8 weeks, or contact your doctor, and it's because they don't want you to be taking this medicine forever if you have a stomach ulcer, God forbid, like a stomach cancer or something like that. But then a lot of doctors will say, well, it is just reflux, it's just gastritis, so just stay on it. But they're not saying, well, just stay on it, it'll treat your symptoms, and then you're going to have these other diseases downstream. So it's important to really work hard to try to find a way off of it. You know, when acid's in your esophagus, it hurts. When acid's in your stomach and your stomach lining is intact, it does not hurt. So any reason that stomach contents go up into your esophagus is going to cause pain. And people with hiatal hernias, which is a very common thing, especially when you have abdominal obesity, or you've had pregnancies, anything that's increased your abdominal pressure has put the top part of your stomach up through the diaphragm. Then that lower esophageal sphincter doesn't come together like it's supposed to. And so you will have, you know, you'll lean over and you'll get reflux, you'll get stomach acid up in there. And those are the people I really feel bad for, because, you know, if you reduce the acid in their stomach, that they won't have that pain, but they're still having the contents of what's in their stomach come up. They're just not feeling the pain. It's very hard to treat. And so there are people that, you know, ultimately stay on the medicine for a long time, and they have usually like a physical reason why they have reflux.
Yeah.
And there are people who have tumors that, or over secretion of gastric acid due to, you know, tumor growth or something in the stomach. So very important to look at all of those things, but just know that most of the people that have these symptoms, it can be treated without medication.
Yeah, HCl, diet changes, digestive enzymes. We use something called slippery elm all the time, because I consider that a food choice. And slippery elm is a demulcent. It's very soothing to the esophageal lining, and so those are some great choices. But diet first and foremost.
Yes. Thank you.